practicing for last 20 years in South Mumbai. I am attached to Breach Candy, Just Look, Elizabeth, Masina Hospital, SRCC Hospital, and Wokhad Hospital. So today my topic is breastfeeding. So breastfeeding, this topic has been really close to my heart. So I have chosen this topic to talk to you about it. Okay, so breastfeeding, as you know, is when mother feeds her baby directly from her breast. But what is exclusive breastfeeding? That is when no formula, juice, or water is being given to the baby for at least first 6 months of its life. So, what are the benefits of the breastfeeding for the baby? So, as it is a perfect mix of proteins, fat, carbohydrates, and vitamins, you don't have to give anything else to the baby. It is easily digested, and babies don't suffer from constipation or diarrhea after being exclusively breastfed. Then it contains antibodies, which help the baby to fight against the viruses and bacteria. It lowers the risk of having allergies and asthmas later on in life. It lowers the risk of ear infection, respiratory infections, and diarrhea. It is associated with increase in the IQ. Then it helps in the bonding between the mother and the child. It causes healthy weight gain and avoids problems of overweight issues in the later in the life. It reduces the risk of sudden infant death syndrome, and it lowers the risk of diabetes mellitus and obesity later in life. So, what are the mother's benefits for the mother? It helps the mother to lose the pregnancy weight faster. Oxytocin hormone, which is released after breastfeeding, helps to minimize the blood loss after delivery because it helps the uterus to contract and it helps the uterus to go back to its pre-pregnancy state really fast. It reduces the risk of ovarian and breast cancers for the mother. What are the benefits of the breastfeeding to the family and the society? So it comes at no extra cost. It saves time and energy and money, which is spent on formula. It reduces the hospitalization for the baby because it gives better immunity to the baby and reduces the risk of pollution. And it, to a certain extent, helps in contraception. So now, why not anything else? Why not formula? Why not cow's milk? Why not buffalo milk? So the answer would be compared to formula, breast milk is easily digestible. So there are no issues of constipations or diarrhea for the baby. It has natural vitamins and minerals and antibodies. Compared to cow milk has high proteins because it is necessary for the calf to grow. So it is not suitable for the human baby, and it has cow milk and the buffalo milk, or rather for that matter any kind of animal milk, will have less of fat and less of carbs, which are important for human babies because in first 2 years of life the growth of the brain is maximum. So now, how to initiate the breastfeeding? For this, there have been lots of initiatives, and there are certain hospitals which are really baby friendly. What is a baby friendly hospital? The baby friendly hospital would be helping the mother within first 1 hour of delivery, whether it is by normal delivery or by cesarean, to start the breastfeeding. And when and how to do the breastfeeding. Generally, it has to be done on demand, or you can say around every 2 to 3 hours in a day and every 3 to 4 hours in the night. Then, which are the positions which are good for breastfeeding? The cradle position. Cradle position is when the mother rests baby's head in the uh, nook of her elbow and turns the baby towards her breast, helps the baby to latch. This is the most common position. But most important thing is the mother should be very comfortable. Second would be the cross cradle. With the opposite hand, she would be supporting the baby. The football grip, as in like how the footballer holds its ball, like that the baby is held against the. This is really good because there is no pressure of baby's weight on the mother's stomach. So after operative deliveries, or especially in the twin pregnancy, twin babies, when mother can feed both the babies simultaneously, the mother can feed the babies lying down or in a laid back position. Most important thing is burping the baby after the feeding is over so that there is no chance of the milk entering the respiratory tract and causing problems for the baby. So now the most important question that the mothers ask us is my milk enough for the baby? Because my baby is crying, or if it's not growing, or my mother-in-law or my mother is telling me that no, your milk is not enough. So it's generally a myth, because generally the body knows how much milk to produce for its baby. So, if the baby is content, not excessively crying, passing pale yellow urine around say 6 to 8 times in a day, and gaining weight, that means the breast milk is enough for the baby. So, what are the real contraindications? Generally, we don't tell the patients not to breastfeed the baby unless and until, suppose if the baby has allergies to the breast milk, or if the mother is receiving chemotherapy for some cancer or on some illegal drugs. Only then and certain infections like open tuberculosis or HIV infections can be real contraindications for breastfeeding. For that matter, nowadays for corona patients also, we do not advise them not to breastfeed the baby. With proper hygiene and mask, the mother can always breastfeed the baby if the disease is not very severe. So, the common challenges which are faced by the mother. So, first thing can be the sore nipple. The sore nipple can be a result of baby not latching properly, or mother trying to remove the breast from the baby's mouth prematurely. So again, ice fermentation and air drying the nipple helps. And sometimes, if it is super infected with infection, then the antibiotic creams can be applied. Then the cracked nipple. So basically, the drying agents like harsh soaps or creams have to be avoided. And the treatment could be with lanolin cream. Then sometimes the mothers ask that we are working mothers, how can I continue the breastfeeding? Then we can tell the patients that pumping the milk and storing it which can be later on used by the family members for the baby, can be done. So the breast milk can stay uh, in the room temperature for around 6 hours, in the refrigerator for 2 hours, and for 6 months when it is frozen and kept in the freezer. In cases of inverted nipple, sometimes the breastfeeding can be a challenge. In those conditions, generally before the delivery, we try to examine the baby the mothers, to check if the nipples are inverted. Then there are certain exercises which can help the mothers. But if they come after the delivery, then the lactational consultants can help them. Then the breast engorgement or infection can be in which the breast can become hard, painful, swollen. In such condition, the antibiotic, gentle massage, and painkillers can help. Naina, hello. So basically, there are lots of myths which are related to the breastfeeding, but most of the time, all the mothers can do it successfully. Even if they have failed the first time, the second time around, again they can be successful. Yes, so Rachna has asked me a question. If the size of the breast affect the milk production? Rachna, not at all. Be assured that it doesn't, because the size of the breast is only because of the fat. Otherwise, the number of the ducts and glands which all the women have is equal. So it is not going to affect. Don't worry. Yes, Mansi, breastfeeding is easy because it is natural. It's very natural. The main important thing is the mother has to be really motivated by the doctors as well as the staff members, the paramedical staff, and she needs a lot of support by her maybe her partner and her in-laws. Lot of support is needed, and with proper nutrition, breastfeeding is really. Yes, so again, like all the mothers, they keep on worrying if if they are producing enough milk for their baby or not. But the body knows, and especially it's the baby who demands, and accordingly, the mother's body is going to produce the milk. If your baby is passing urine 6 to 8 times, which is light yellow in color, not dark yellow, and if your baby is gaining weight, if he is passing stools, and especially if he is content and not crying excessively, that means he is receiving enough milk. Okay, so Geet, you have asked me how can you improve the milk supply. So frequent feeding will help. Okay, massaging the uterus and massaging the breast will help. Then your intake and your nutrition is very important. You have to have adequate amount of milk. Then you have to have adequate amount of water and your nutrition. That will help. And if not, there are medicines which can be used, which your doctor will advise you. So Vandana has asked me how to prevent colics during breastfeeding. First and foremost, after the breastfeeding is done, burping the baby is very important so that the gas which has entered while feeding has to come out. That is one thing. And main importance is mother's diet. So mother's diet is also important. And third thing, if you stick to exclusive breastfeeding, as in nothing extra, then the baby will not have colic. So Uma has asked me how to cure the sore nipples. So if you have the problem of sore nipples, if the breasts are remaining wet all the time, then that can be a problem. So you can air dry your nipples, clean them properly, and if there is a problem, you can put lanolin cream. Okay, and if there is infection, then antibiotics. Okay, so Palak has asked about inverted nipples. So Palak, with coconut oil or olive oil, you can hold your nipple and try to pull them out. If that doesn't help, that has to be done quite frequently. If that doesn't help, then the breast pump that can really help. And nipple shade can be used till and your baby would be the one who can really suck and bring out the nipple. Okay, so that problem will not be there. Nipple shield is safe, but you have to maintain the hygiene. Okay, so Uma has asked, can I breastfeed if my nipples are bleeding? Yes, you can still breastfeed, but then if it is bleeding, that means either they are sore or if there is any, or there may be infection. You have to get yourself checked by your gynecologist. So Manisha has asked how to avoid and soothe the engorged breast. So if the breasts are engorged, you can give alternate hot and cold fomentation, like taking ice packs and then taking hot water bath, massaging the breast gently with coconut water, hot water bottle. All these things will help. So one of the patient has asked how to maintain a good breastfeeding latch. So for maintaining that latch, you have to hold your breast in like a scissor-like fashion. You have to see to it that not just the nipple, but the areola, which is a black skin around your nipple, the whole thing has to go inside baby's mouth because the sinuses or the milk reservoirs are placed just below the areola. So unless and until the whole portion goes in baby's mouth, baby will not be able to suck properly. So Padma has asked, when should I start pumping? So Padma, if you're pumping as in, do you want to go back to work? That's why you want to start pumping. So if that's the thing, then you can start as you know as early as 2 or 3 months. When nowadays we get good maternity leave, say around 6 months or so. So maybe if after 6 months, if you're planning to go join your work, then maybe after 5 months, once the baby is 5 months old, you can start pumping and storing the milk. Like I said, you can store it for 6 months in the freezer, deep freezer, up to 2 days in the refrigerator, and up to 6 to 8 hours at the room temperature, depending on the temperature. So someone has asked, what is breastfeeding jaundice? There's nothing called as breastfeeding jaundice. Basically, would be the jaundice of newborn, which the newborn babies, out of 10, around 2 to 3 babies do get jaundice. Because what happens is their livers are not mature enough initially to take over the excretion of bilirubin. So a lot of newborns do get it, but it's not because of the breastfeeding. Rather, the breastfeeding will help to clear out the bilirubin. So someone has asked that, should I stop breastfeeding if I am sick? Like I said, there aren't any real contraindications for breastfeeding, except for someone who's a cancer patient, is on chemotherapy, or using some antidepressant, or drugs for psychological illnesses, or having open TB or HIV infection. Sorry, I got confused. So, in case if you have mild flu or any other illnesses, it is a better idea to still breastfeed your baby, because your body will be making antibodies against the disease that you have got, and those antibodies will be passed on to your baby, and your baby will be saved from that infection. Only thing is, if you have flu, corona, or any other infective diseases, you have to see to it that your baby doesn't get it, so that you can wear a mask, wash your hands, or use hand sanitizer. So someone has asked, how long can I breastfeed? So like we tell the patient that 6 months should be exclusive breastfeeding. After 6 months, you can start weaning the baby, as in to start the top feed, like the rice water, dal water, that can be started. And you can continue breastfeeding up to 2 years. It will depend. If you are working, then like I said, you can pump the milk and keep it for someone at your home to feed your baby. So someone, Geeta has asked, how much should a newborn be feeding every day? And her baby is 4 days old. See, like how all the human beings are different, all the babies are different. So the babies who are generally good weight may not require that much of a nutrition. They may require feeding every to uh, uh, say around 3 to 4 hours in a day, and every 4 hours in the night. The babies who are a bit less in weight may require feed every 2 to 3 hours in a day, and maybe every 3 to 4 hours in the night. So thank you, everyone.